Hello everyone, Dr. Travis Howell here with a short little video on why some kids get chronic ear infections. We should start by saying ear infections are absolutely common, but not normal. So why does your kid keep getting ear infections? Well, I can certainly tell you it's not because they keep walking through a cloud of bacteria, but rather it's because of fluid accumulating in the ear, inflaming the tissue, and stagnant fluid is the perfect environment for bacteria and virus to flourish. Well, the question is then, why isn't the ear draining? Well, for example, when you take a bite of food, gravity doesn't just plop that food right into the tummy, but through a series of muscle contractions, the esophagus essentially milks that food down the esophagus to the stomach. This is ironically why you could swallow while standing on your head. Well, in a very, very similar process, the tensor veli palatini muscle, or the TVP, is the absolute key to this in the ear. Its job is to milk the fluid out of your ears so it can drain down your throat. In kids that get chronic ear infections, this TVP muscle is spasmed, thus not letting the fluid through the eustachian tube, and we get this buildup of fluid. Well, then the question is, why would that tensor veli palatini muscle be in spasm? Well, 9 times out of 10, we can trace this directly back to the birth process. The tensor veli palatini muscle gets its nerve supply from the top part of your neck, which is also the most vulnerable part of the baby during the birth process, especially if there's assistance with something like forceps or vacuum extraction, and certainly when there's a C-section delivery. There's a tremendous amount of pressure and stress placed on the child's neck. The nerve to the tensor veli palatini gets irritated and it stops working, and fluid doesn't drain, and the kid ends up with an ear infection. Well, the question is, can antibiotics help drain that fluid from the ear? Well, no, they cannot. So, is it a better option to drill a hole in the eardrum to drain that hole? No. And that's why countless articles in the American Academy of Pediatrics have said for decades not to give antibiotics to kids with ear infections, and because they do not only it's not only because they don't help, it's because they actually increase their chances of getting future ear infections as well as developing things like allergies and asthma. And in fact, their best guideline is to do nothing at all. But obviously, as a healthcare provider, parents don't like it when we tell them to not do anything at all, and so we're here today to give you an answer. What can you do about it? Well, the number one thing is to get the tensor veli palatini muscle working again, and that's where chiropractic comes in. We need to restore the normal function to that muscle, restore the normal nerve supply, and the ears will start to drain. We absolutely see it every single day through safe, gentle, and effective chiropractic adjustments that restore this normal nerve supply and restore this normal drainage function, as you see there with the tensor veli palatini muscle and the eustachian tube. So you might ask, how can you find this? Is there a way that you can find out if your child has nerve interference causing this spasm? And the answer is through some pretty awesome space-certified technology that we use here in the office. As you can see there, it is non-invasive. It is absolutely painless. Sometimes the kids will giggle because they think it's ticklish, or it tickles. There's absolutely no radiation, and it allows us to make a certain determination, and there's no guessing as far as what is causing these ear infections. So what will it look like is a scan like this on the left where you have all that color at the top of the neck. Well, we don't want that color there. And so after a series of adjustments, that's usually what it looks like, nice and clear and all white. This is actually a scan of Mr. Sampson, and his entire story is on our website, featured on the Health Hero podcast, if you want to check that out. I think you'll enjoy listening to what Mom has to say about Sampson, but real quick, he was scheduled for surgery when we met him, and after going through a course of care, he still went to the ENT to follow up, and he was no longer a candidate for surgery. And so Sampson's got a really awesome story, and I know you'll love to hear it, so check that out on the website. But wouldn't it be great if your child was that next chiropractic success story? And I encourage you to find out if your child is a candidate for chiropractic care. This is our information here. We are located in Bettendorf on Tech Drive, but obviously with the World Wide Web, this video will be seen all over the world. So if you are not in Bettendorf Iowa and you would like to find out more information, please contact us and we will connect you with a certified, trained pediatric chiropractor in your area.